So what we're trying to do is we're trying to get all of you to think in terms of 4 boxes. And this is a very different model, which we think is a very practical model. We had a fascinating meeting last week with some 13, it turns out there are 13 Republican doctors who are in the U.S. House of Representatives now. Almost 10% of the Republicans in the House are doctors. They're not quite rivaling lawyers yet, but they're on the way. And it was fascinating. And so they formed their own caucus to work on health issues because they collectively think they know a fair amount about health. Some of you who work with doctors appreciate this. The Congress usually doesn't meet really early because the Congress tends to run pretty late in the evening. And the only time I could meet with them last week was 7:30 in the morning. And all of them had this kind of doctor pride. Oh, 7:30 is nothing. Because they're all used to making rounds. They're all used to being interns. And they did show up. I was pretty impressed with the group. And they seemed mostly awake. But part of what we talked about was thinking in terms of this new model of 4 ideas, which are in your handouts, and you'll see us come back to them again and again. The first is individual responsibility. So as you think through everything, whether you're talking about an employer looking at their employees and worried about health costs, or you're looking at a hospital system trying to think through its patient base, or you're talking about how a community might think about better health, if you'll notice the way we design it, we start at the opposite end from most political language. Most political language is trapped in box 4. How do we pay for it? We start at the other end. And we say, what you pay for is really important. Kentucky in 1994 tried comprehensive health reform and it crashed and burned because they couldn't afford it. Tennessee tried TennCare and it crashed and burned because they couldn't afford it. Massachusetts has tried it. They're in the process of learning they can't afford it. The fact is, if the federal government tries to solve the financing box without having thought through the other 3, they will invent a system which will decay rapidly into Medicaid. And there's zero proof that the U.S. government is capable of sustaining a large nationwide health program with the kind of money. We dedicated huge resources to Medicare. We are not going to do that twice. And in fact, if you look at how much money they're currently spending on the various stimulus packages and the various bailout packages, I think it's very hard for them to afford the scale of health reform they want. Because the money's just not there unless they're just going to print money and end up in inflation, and then that creates a whole different set of problems. So I think if you take the current system unreformed and you simply solve the payment problem, you solve nothing because it ultimately bankrupts you. So we start at the other end. How do we get you engaged in knowing about your own health? How do we incentivize you to take care of your own health? How do we build the information system that supports you? How do we make it easy for you to develop the right attitudes? And what should we expect of you? So we start with the idea we have to rethink the incentives, the information flow, and the responsibility so that you're engaged. Number 1. Number 2, you want the society, whether it's the city, the county, the church, the business, the hospital, you want the society rethinking how it reinforces the right behavior. For example, we've had huge changes in my lifetime over using seatbelts, which is actually second only to tobacco as the best single way to extend your life. If you go to Real Change, which is a great little website, and you put in all your data, the number 1 thing that gives you a worse age is tobacco. The number 2 thing is not using your seatbelt. So when we talk about the 3rd box, we want to fundamentally rethink it from the ground up. What would professional care in America be like? What would the health delivery system be like if it started with early detection, early wellness, if it started with disease management, if it worked through all, and if it used technology to maximize our ability to do these things, and if it integrated the information flow. And you'll hear at some point today from MedImpact about ways in which you can begin to integrate all sorts of data about prescription drugs and other things that allows you to really have a very powerful model of where we're going and what we're doing. And when you go around the country, and what we try to do, part of the purpose of the center, is to look for best outcomes. And then do a model. I have a very straightforward, because I'm a historian, and my very straightforward principle is that imitation is cheaper than invention. So if you were to go across Missouri and figure out the 20 biggest targets of change, My first advice would be, and the whole purpose of the center would be to say, let's see who we can find who's already doing it. Because let's see what we can learn from them about how to transfer that success, as opposed to let's try to invent it ourselves.